Welcome back to a special half hour of Channel 5 News at noon dedicated to Heart of the Valley, Healthy Heart. February is Heart Month and health professionals are using this time to raise awareness. They want to make sure heart health is a priority for the community. Channel 5's Gabriela Garza found out how you can reduce your risk and live a heart-healthy life.
High blood pressure, high cholesterol, and smoking are key risk factors for heart disease. About half of Americans have at least one of these three risk factors, according to the CDC. Now, the numbers are alarming and the diagnosis can be frightening, but there are ways to help your heart.
Has anyone in your family ever had a heart attack, stroke, or suffered from heart failure? Family history is an indicator of risk in developing heart disease.
For cardiovascular disease, about 30% of your risk of developing cardiovascular disease is genetic-based.
Joanne Curran is a professor of human genetics at the UTRGV School of Medicine. She's been working with a team of researchers studying genetics in complex diseases like diabetes and heart disease in Hispanic families in the South Texas and northern Mexico region for years. According to the CDC, heart disease is the leading cause of death for men and women and people of most racial and ethnic groups in the United States.
With Hispanics, heart disease or cardiovascular disease is actually not the #1 cause of death. It's cancer. And cancer and cardiovascular disease are both very high, very close.
Curran goes on to say that Hispanics are at a greater risk of developing type 2 diabetes than other populations, which is also a risk factor. The more risk factors you have, the greater the risk of developing a cardiovascular disease. Dr. John Mark Morales is a cardiothoracic surgeon. He says people can make the necessary changes to be proactive.
Cigarette smoking is a big one, and of course if you smoke you need to stop smoking. Genetics, if anybody in your family has a history of cardiac death or early coronary artery disease, you need to be very much aware of it. High blood pressure, you need to control your blood pressure, have a low salt diet and take your medications. And diabetes is a big one.
The American Heart Association has created Life Simple 7. It identifies the most common risk factors and ways you can improve them, including reduce blood sugar, get active, lose weight, and eat a healthy diet.
In the Rio Grande Valley, there are plenty of options to choose from when it comes to finding something to eat. So during lunchtime, when you might be running low on time and trying to find something that's easily accessible and convenient, you might reach for something like this, your favorite tacos from your favorite taqueria, or maybe you are feeling like a good old hamburger and fries. And although these are really yummy, they may not be the best option, and you don't want to try to reach for these every single day. It's something to enjoy in moderation because they have little to no nutritional value. However, instead, you should be reaching for something like this, something with whole grains, your lean protein, and of course your vegetables, and you don't want to forget your fruit.
You just think that cardiovascular disease is a disease of the older population, but in reality, no one is exempt from it.
The American Heart Association has plenty of tips on how to combat heart disease at any age. For more information, you can visit krgv.com after the newscast for links to heart healthy tips. In the studio, Gabriela Garza, Channel 5 News at noon.